to 19 minutes to 7 o'clock. Now, better pay for health workers, an affordable and reliable supply of medication.
Quality care for all and new and improved infrastructure. These are just some of the promises political parties have made ahead of the May general election.
Well, has it given the country some hope, or is it seen as yet another string of promises just to bag votes?
Well, our reporter Maseko Ratlacha went to find out from those working in the medical field.
56-year-old Frida Ndima has been a community healthcare worker here in Alexandra for 4 years now. She and others like her have been hailed by government as the backbone of the country's health system. One of her patients is Linda Afia, who is now 6 months pregnant.
So I've been sick November, December, until Jan. She was still checking on me. I wasn't eating, I was sick, but she was there with me always.
Passion and a love for people are what motivates people like Frida. But they wish more could be done by government to help keep them going.
The government, what is doing, I don't see anything that he's doing. They keep on promising us that we are going to be permanent. But as from today, we are not. This is a heavy, 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 heavy job. And please, if the government can, please, because the government see what we're doing, but they're so ignorant. They must please, please, please help us and please make us permanent.
Political parties have launched their respective election manifestos, and the promises for better health services and working conditions are contained in many. The finance minister also recently undertook to inject more money into the sector.
We need more doctors and nurses. 2.8 billion rand has been reprioritized to a new human resources grant and 1 billion for medical interns. 1 billion rand has been added to raise the wages of community health workers who will earn 3,500 per month.
But for those who have just entered the medical field, and for those who are planning on doing so, actions speak louder than words.
Well, I'd have to take Mr. Tito Mbowene's word on this one. I am comforted by the fact that they made the initiative to speak to us and tell us these things. But, whether they implement them, we'd have to just wait and see.
I feel like this is another election year since that there were these Cuban bursaries that have been stopped. Why have they stopped? And then suddenly there's been a promise that there'll be more money. Where is that money going to come from?
The Gauteng Health Department has recently added about 9,000 community healthcare workers to its payroll. This is in an effort to improve access to care. But is it just in time for the election, or will promises be fulfilled after people have cast their ballots? Maseko Ratlacha, Johannesburg.
Leading NGOs are hosting a summit for healthcare workers to discuss their working conditions. The summit is set to